is episode 84 of the Real World Wellness Podcast. Hi everyone, I'm Christine Lehman, a nutritional therapy practitioner and the reverse diabetes coach, which is also the name of my website. I see clients in person and remotely, and I'm accepting a limited number of new clients in April. Please remember while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. I am really excited to have Dr. Joe Tatta on the program today to talk about his new book. Dr. Joe Tatta is a doctor of physical therapy, board-certified nutrition specialist, and functional medicine practitioner who specializes in treating persistent pain and lifestyle-related musculoskeletal, metabolic, and autoimmune health issues. He is host of the Healing Pain podcast, designed to broaden the conversation around natural strategies towards solving persistent pain. Dr. Tatta is the author of the #1 best-selling book, Heal Your Pain Now, a revolutionary program to reset your brain and body for a pain-free life. He is currently in private practice and also provides online health consulting to help people achieve a pain-free life from chronic disease. And you can learn more about him by visiting Dr. Joe Tatta, and that's tatta.com. So welcome, Joe.
Hi, Christine. It's great to be here. I'm really excited to talk to you today.
Yeah, no, this is great. So to set the stage for our conversation, I wanted to read one of the many positive book reviews you received. Quote, Dr. Tatta provides important perspectives in Heal Your Pain Now on the role of weight loss, nutrition for pain relief, and the role of the brain in pain. And he calls it pain catastrophizing. Breathing exercises for stress, strength and posture activities, and much more. So it sounds also like a great resource. And
thanks for reading that review.
Yeah, and he goes on to just say, I applaud his efforts and his passion for his patients and his readers' overall health and well-being. And that was from Dr. Schechter, who's a sports medicine chronic pain specialist. So yeah, I was really impressed with not only the breadth of the content and the scope of the book, but also that you really received just so many glowing reviews from so many people in the field, from practitioners primarily.
Well, what's interesting about the world of pain as far as practitioners go is that it really overlaps with a lot of different types of practitioners. So whether you're a primary care physician, whether you're a physical therapist, whether you're a chiropractor, a nutritionist, a psychologist, there are many, many types of practitioners that are seeing pain as either the #1 or sometimes the #2 complaint in their practice. So, we know that obviously a lot of people struggle with pain. We have about 100 million Americans who struggle with pain. But we also see that in our clinics every day. So practitioners are very interested in this topic as well.
Yes, that makes a lot of sense. So what inspired you to write the book?
Well, it's a big story. I would say it's really treating people with pain is really the culmination of my life's work. But going way back into my history, into when I was a child, actually, my mom was actually a nurse, and she was a nurse who worked on the adolescent cancer for the hospital. And she actually worked the night shift, so at night she would go and she'd take care of, obviously, kids who were terminal with cancers back in the 80s when the treatment for cancer wasn't so wonderful. And during the day, she would do all the things that supermoms do. Take care of the house and the kids and the dog and do the shopping. So she was obviously, like many supermoms do, juggling multiple things at once. And that worked for a couple of years, but then she eventually led to the point where she was really burnt out. And she wound up having awful digestive problems. She had chronic back pain and chronic neck pain. She kind of bounced back and forth between anxiety and depression. And, this is all through the mind's eye of a child. And when we look at children that experience a trauma, and for me, on some level it was a trauma, but kids either become traumatized themselves from that, or they process it and later on use it in life. So for me, I was always interested in, okay, how do we help people with their chronic health disease and specifically chronic pain? And what's fascinating is that my mom healed herself 100% naturally. So she didn't rely on drugs. She didn't rely on a surgery. She didn't rely on injections. She figured out on her own because she was a nurse and she had some baseline medication, or baseline education, I should say, on how she can heal herself naturally. So I watched her go through that process. So from there, it made me very interested in healthcare, and I got very interested in treating people with chronic pain. And fast forward, I've treated people now with chronic pain for the last about 22 years, and I've seen not only the, I would say, misuse of opioid medication, but also the misguidance of our healthcare system in helping those with chronic pain heal naturally.
Mm-hmm. So that leads me to my next sort of question is, why have conventional approaches failed?
Conventional approaches for pain are really designed for acute pain, and it actually works very well for acute pain or an acute injury. And acute pain it's what we know, Christine. Acute pain is when you fall and you scrape your knee, you have a cut and you're bleeding. It's when you sprain your ankle and you tear the ligaments on the outside of your ankle. It's when you fall and you fracture your arm. So that's acute pain caused by an actual tissue injury. And with acute pain, our current medical model, or what's known as the biomedical model, which revolves around drugs and surgery and medications and injections, works very well for acute pain. And we're very happy to have it. The challenge comes in when we start to talk about chronic pain, because chronic pain is less about the actual tissue and more about other changes that are happening in the body, both on a physiologic level as well as a neurophysiologic level, so as well as what's happening in the brain and nervous system.
Mm-hmm. So would you say that you've adopted more of a biopsychosocial model?
That's right. So the model we're really pushing forward, the one thing that I talk about to practitioners and when I talk to podcasts, I mentioned this big fancy word which is biopsychosocial. And that means that there's more to pain than really what your attention is drawn to. When you have pain, your attention is drawn to the painful part of your body. And oftentimes that gives you the sensation or gives you the feeling, the perception that you're damaged or there's some kind of damage in the area. So here's how pain works. When you have an injury like that sprained ankle or that broken arm, is an actual tissue injury, and your body has a really incredible way to fix that tissue or to heal your injury. It's called the inflammatory process. And the inflammatory process is actually a normal, healthy thing. That's how your body repairs tissue. What we know about that inflammatory process is that it's very predictive. So within about a 3 or 4 month period of time, your body will go through that natural inflammatory process and it will heal whatever tissue is injured. And obviously, once that tissue is healed, your pain will go away. If pain continues beyond that 3 or 4 month period of time, then we know it's less about the tissue, so it's less about the tissue being injured. And we need to look more toward the other systems of the body to see how we can actually heal the pain that you're having.
Mm-hmm. Well, that makes sense. And is that very common, though, for people to transition from acute pain to chronic pain?
It can be. For some people, it really can be. We have an epidemic not only of chronic pain in the country with about 100 million people that struggle with chronic pain, but we also have other epidemics of things like autoimmune disease. Chronic neck pain is probably the number one chronic pain syndrome that we struggle with, and for some reason, we're still learning, based on the newest pain science, so to speak, about why pain persists for some people and why pain goes away in others. And we don't really have a good answer just yet. We have a couple of reasons why that happens. But ultimately, the reason is not so important. What people really want to know is, how do I heal my pain?
Right.
If I get rid of my pain, how do I move on to live a pain-free life? But for the practitioners, it can be very interesting because the science behind someone with chronic pain is actually very fascinating.
Mm-hmm. So we've talked earlier about the rise in chronic diseases. And so are you seeing a correlation here between the increase in chronic diseases, and you just mentioned autoimmunity or autoimmune disorders, but there's also, as we know, epidemics of obesity and type 2 diabetes and so on. So is this where you're seeing an associated rise in chronic pain?
Yeah, it's really fascinating to think about. When I started practicing in 1996, we're really just on kind of the tip of the obesity epidemic. And we really just started saying, okay, this is a big problem. We need to start to look at, obviously, how people are eating and what they're eating. And, of course, what type of movement they're doing and their stress level and all the things that we know that relate to obesity. But, yes, what's interesting is as the obesity epidemic has risen, we have seen a number of chronic pain diseases rise with it. I mentioned already the autoimmunity, the joint pain such as back pain, neck pain, osteoarthritis, rheumatoid arthritis, fibromyalgia. Many of those diseases have an inflammatory basis to them. Obesity in and of itself is an inflammatory condition. So we know that for many people, there's an inflammatory component to their pain that needs to be addressed. And this is what traditional medicine has not done a really good job at addressing. Because when you go to, let's say, your primary care physician, they may prescribe an opioid for you. An opioid is a painkiller, a narcotic painkiller. And that narcotic painkiller works on your central nervous system, doesn't work on inflammation.
Mm-hmm.
So if you have, let's say, osteoarthritis, if you have rheumatoid arthritis, if you have any kind of autoimmune disease, that's not really going to work, and that's not a fix for it. And we know that opioids are not a long-term fix. The science isn't there for it, the research isn't there for it, and in clinical practice we know that it's not a long-term fix for those with chronic pain. So as we've seen obesity increase, we've seen all these other diseases kind of follow suit.
Right. And so there's a connection between weight and pain, correct?
Absolutely. So the connection is really twofold. I think the connection that people make most readily is that they kind of get the idea that, okay, I have extra weight on me, and the more weight I have, the more pressure it's going to put on my joints. That's oftentimes why we see those who have obesity or those who are overweight have back pain or hip pain or knee pain, because there's more pressure on their joints.
Mm-hmm.
For every 5 pounds of extra weight that you put on your body, somewhere between 1.5 to 3 times as much weight on the joints can occur, depending on what type of activity you're doing. So if it's just walking, it's probably about 1.5. When you're going up the stairs, it's probably about 2 to 3 times the amount of weight. So there is the fact of increased pressure and having it somewhat wear down some of the tissues.
Mm-hmm.
What I think is more important for us to talk about is that the belly fat that sits around your midsection
Mm-hmm.
is inflammatory. It produces inflammatory chemicals. We call them cytokines or adipokines. They're inflammatory chemicals that travel around your entire body, and they get deposited in certain types of tissues. And Christine, you know as well as I do, the human body is mostly muscle tissue. It's muscle and bone and tendon and ligament. And oftentimes that can be the one area that becomes inflamed and painful and sore when you're living with chronic obesity.
Now, are you referring to visceral fat?
That's correct, yes.
And what is the danger of having that? I mean, you mentioned the cytokines, but my understanding is that wraps itself around your organs, which contributes to metabolic syndrome as well.
That's correct. And metabolic syndrome is similar to obesity, and it's similar to diabetes. It's in that realm of diabetes, and it's an inflammatory condition. So you'll see certain blood values elevate, and we're really trying to paint a picture for someone that when you have extra weight on you, it's not just obviously this physical problem, that there are chemical problems that happen in your body,
Mm-hmm.
there are chemical problems that happen in your bloodstream, and it leads to that chronic inflammation that leads to chronic pain.
Right. So that's definitely the connection there. Perhaps you can describe a few people in your practice who have this visceral fat, for example, or even, and the other interesting thing I think worth pointing out is you can only be even 10 pounds overweight and or even within a normal body weight and have visceral fat because it's just around your abdomen.
That's correct. And some people genetically will have a tendency to put the fat around their abdomen versus other places, which is less problematic, like the hip area. What's fascinating is I did a little study in my practice one day, and I took a survey to see how many people were obese within about a 3-month period of time, and how many people were just overweight. And the numbers were shocking. So upwards of 80% of people coming into the physical therapy practice were overweight, and about 60% of them were obese. So many of these conditions, many of the chronic pain conditions that we're treating as physical therapists, as chiropractors, another profession that treats people with musculoskeletal pain, have obesity as the underlying cause. And most readily, we look toward osteoarthritis, because that's the number one complaint that people often come into a physical therapy practice with. They have some kind of joint pain that oftentimes is linked or related to osteoarthritis. So, when I think back, just a couple of days ago, I have a woman. She's probably about 50. She's about 52 years old, and she has osteoarthritis of her right knee and her left hip. And at first, when you come see a physical therapist, obviously the word physical tells you, okay, I'm probably going to be doing some kind of motion or movement or exercise, and maybe the therapist is going to stretch me or do some joint mobilization or manipulation. But I actually wound up spending the first 2 visits taking a nutritional intake and then educating her about the nutritional changes that she needs to make in her life to affect her weight and to lower the inflammation naturally in her body.
And how did she respond to that?
It's interesting. Some people are shocked. So if they walk in and they don't know too much about you, they're a little bit shocked. They say, I didn't know that you use nutrition to help treat people with pain. Although very rapidly people start to make the link. And oftentimes people say, I know I need to clean my diet up, or I know I need to eat less sugar, or I know I need to stop snacking. So people make those really fast connections to things like sugar and snacking. They don't make some of the deeper connections that I talked about when it comes to the biochemistry of the body, the healing of the gut, decreasing inflammation in their body, the microbiome, all those factors that lead to less pain when you approach them.
Mm-hmm. So this might be a good opportunity to just run through your book in terms of how you use nutrition to help with pain.
In my book, Heal Your Pain Now, one of the things that people are often interested in and surprised by when they open the book, one of the major parts of the book is on nutrition. So a large part of my book is about the steps you can take to heal your pain or to heal your pain naturally with using food as medicine or a food-forward approach or using nutrition first to heal your pain. So oftentimes people say, okay, what's the first change I can make in my life when it comes to nutrition to help with my pain? To keep it really, really simple, Christine, what I tell people is if you're eating a standard American diet, which is typically one that is full of processed foods, I say if it comes in a box, a can, or made by man, then it probably has no place in your diet. Now, what does that really mean? It really means that I want you to shift from a diet that's mostly processed foods to one where you're eating whole foods. So obviously fruits, vegetables, meats, whole grains, all those things obviously have a place in the diet, one where you're moving away from processed foods that come in typically boxes, cans, or something that's made by man in some kind of store that you're walking into. But when you do that, you're automatically increasing the nutrient value because you're getting foods in their whole natural state. And more importantly, you're eating foods that don't have anything added to them. So things like preservatives, additives, extra sugar, extra fat, chemicals that may be put in intentionally or chemicals that may be by accident sprayed on things and wind up in the food supply. All those things really rapidly come to a halt or are eliminated once you move to a whole foods diet. So a whole foods diet is often the place where I'll start with someone where if they've never ever tried any kind of nutritional intervention, so they've never been on any kind of diet, they've never seen a nutritionist, they've never read a book on nutrition, and they're just really starting to learn, I'll meet them where they are so I can start to guide them through a really simple, easy process and move them toward a whole food diet. And some people do really well just with the whole food diet. Just getting off the processed foods, getting out the snacks and sugar and extra fat that's added to food, they do really, really well.
Yeah, it's amazing what that change will do.
It's incredible. And people don't really make the connection until they start to eat that way. And then they say, oh, now I understand why I've seen things about the Mediterranean diet in the news. And I say, yeah, that's true, because typically, historically, not so much anymore, but historically, they had less processed food in Europe. Mm-hmm. America really was the home of processed food.
Right.
We really have exported our diet around the world, and that's why we see the obesity rates, the diabetes rates, and the chronic pain rates are similar in the United States to the other countries around the world.
Mm-hmm. Yeah, it's always very sad. Even immigrants, there's studies that show that they were much healthier before they adopted a more standardized American diet. So I was also thinking about, since inflammation plays such a major role, what kinds of foods would be pro-inflammatory and what might be anti-inflammatory?
I talk about this in my book as well, Heal Your Pain Now. So the second chapter of the book, I talk about healing the gut. So in the gut section chapter, we dive really deep into the foods that are inflammatory. And the first three foods, and we're taking foods out that are inflammatory, and by doing this, you can often see your pain decrease within a matter of 3 to 4 days, from like an 8 out of 10 to like a 1 or 2 out of 10. The top ones are gluten, dairy, and sugar. And many of these we've heard about. I'm sure you've talked about them before on the podcast. Sugar is really extra calories, so it puts on that belly fat that we talked about previously. It raises your blood sugar, which raises your insulin, and when blood sugar and insulin get raised, inflammation naturally raises in the body. And it really has no nutrient value to it. So there's not a lot of nutrition in table sugar, and there's certainly nothing of value in things like high fructose corn syrup, which are sugar that is made basically in the factory. Mm-hmm. After that, it's really looking toward gluten. And the reason why we look toward gluten, which is a protein that are found in grains, is gluten is the one thing that can cause a leaky gut. It's the one thing we know in our food supply that causes a leaky gut, which can lead to autoimmunity and lead to persistent inflammation in your body. The third and final one that I talk to people about is dairy. And oftentimes people say, dairy, well, I thought dairy was healthy and I need it for my calcium, and it comes from a farm, so it must be a whole food. And the truth is, for those that are intolerant to gluten or have an allergy to gluten, such as celiac disease, oftentimes the casein protein in dairy to the body looks just like the gluten protein. So by eliminating dairy, oftentimes you will decrease that inflammatory cascade that is common with gluten as well. So those are the three inflammatory foods that I talk about that are most critical for decreasing inflammation in your body.
Mm-hmm. Along the lines of dairy, often for people who might have like even a lactose intolerance, there can be fermented foods like fermented yogurt or cultured yogurt that they can sometimes tolerate a little bit better.
Yeah, the magic number there is probably about 10 grams. So if you have a lactose intolerance, usually most people they're kind of okay for about 5 to 10 grams of something dairy. But after that, they will notice a reaction to it, or they'll notice some kind of digestion problem. And 5 to 10 grams is basically a really small piece of cheese that you can fit in the palm of your hand.
Mm-hmm. Right, exactly. And also, food allergens is another big problem here, along with food sensitivities, which you address. So it's very common for people to have one or more of these, I find, in my practice.
Yeah, people can have upwards of, if you have a really bad autoimmune flare, it's not uncommon to see upwards of 8 of these foods. But in general, they're typically somewhere between about 3 and 5. Is usually the sweet spot that people need to eliminate from the diet.
Mm-hmm. So another player in all this is fiber, the lack of fiber in the diet. So you want to address that?
That's a big one when we talk about processed foods, because as a processed food, they're stripped of the natural fiber that comes in food. So when you move back to that whole foods diet, you're including fiber in your diet. And I really want people to aim for about 30 grams of fiber a day. And when you do that, it keeps you full longer, so you're less hungry, so you're less likely to snack. It lowers your sugar response. So the food that passes from your stomach into your small intestine and gets absorbed slows down, which slows down the blood sugar rise, so inflammation doesn't rise as fast. And then what's most important, especially for women, because women are often the ones that have chronic pain, is fiber is really important at removing excess estrogen from your body. When you remove excess estrogen from your body, it helps decrease inflammation. We know that people who have too high of estrogen or too low oftentimes have problems processing pain.
Mm-hmm. Yeah, that's really interesting. Why is that, do you think?
Why is that? We said the estrogen receptor on your cells can sometimes sensitize different types of pain receptors in your body. So typically you see some people who have estrogen dominance where the estrogen is too high, and they're often sensitive to just normal touch. You often see this in patients with fibromyalgia where just a gentle massage or someone just gently pinching them will be very, very painful.
And what about low estrogen then? It's the opposite?
It's seen a lot less in clinical practice, but also some of the research says that if you have decreased estrogen or low estrogen, that you may have a similar pain processing problem, but it's seen a lot more with people with higher estrogen.
So, but just to finish up on the low estrogen, which, is postmenopausal women generally have lower estrogen. So, are you saying that their tolerance for pain is higher?
And then the tolerance for pain can be lower, and then it really depends on which type of estrogen we're looking at, because there are about 5 different estrogen metabolites. You get to kind of, get a good functional medicine practitioner who can do a hormone panel for you and look at the different types of estrogen and try to figure, okay, are they all in line or multiple types need to be rebalanced?
Which, speaking of which, you do some functional medicine in your practice, correct?
I do. I started studying functional medicine a couple of years ago, and I got involved in nutrition and have worked into my practice with, obviously, with the patients who need it.
Which is terrific. So you have a whole array of tools there. I'm looking at your book again, and you have the story about Margaret, who was quite, I believe she was obese, and just to lead off, I'm quoting you here, you say, it's on page 11. I often have patients who may be working hard on the physical aspect of their program, but it's not until they begin to alter their diet that they finally achieve results. And then you go into the story about Margaret, who came to you with a complaint of lower back pain. And she was very sedentary. But it was, and she apparently was doing pretty well with the exercise, but not getting much relief. And her diet consisted of coffee and a croissant.
Yeah, what's really interesting about Margaret is that she had seen a number of physical therapists before she saw me. So when she came to me, of course, we talked for quite a while, and I said, are you doing the exercises that the physical therapist prescribed you? She said, oh yes, I do them diligently about 5 days a week. I said, that's awesome. I said, because now we know that the cause of your pain is not mechanical. Because you're doing these exercises and you're not getting relief. What's interesting about back pain is there's a pretty good amount of research that looks at the small little blood vessels around the spine. And as someone moves into that metabolic syndrome, as they move into cardiovascular disease and their arteries, quote unquote, get clogged, we think, of course, about the heart arteries being clogged. But you have arteries all over your body of varying sizes, and the smaller ones are oftentimes the ones that get clogged first. And there's actually a very rich blood supply around almost every bone and joint. So when I started moving her on the path with her nutrition, not only do we see all of her blood values change and her metabolic syndrome change, but her back pain went away.
Yeah, that's amazing.
We know this. We know nutrition is probably the number one strategy we should use for people with cardiovascular disease, for those at risk for heart attacks and strokes. But we've never really kind of tweezed out this thought process that, okay, well, where else are the arteries going? And what other symptoms could it be causing? Because if your arteries are clogged, you're not getting the blood flow you need to the joints and muscles. You're not getting the nutrition you need to the joints and muscles. and most importantly, you're not delivering oxygen to your muscles and tissues. So when she went through this process, her physician actually called me and said, I'm really impressed that you're able to solve her back pain, because I've been sending her for physical therapy and massages and acupuncture, and I think she maybe even tried cupping at one point, which was all the rage. And I said, no, it's just that, we have to look at the person as a whole and see what's working for them and what's not working for them.
Right, and I think what I find interesting here too is that there's a symbiotic relationship here between the pain and the weight loss, so that as her lower back pain improved, she and lost 7 pounds, and then as the weight and the pain began to decrease, her ambition for more exercise followed, and she joined a gym.
That's right. So oftentimes we know that when pain ultimately is about protection. So whenever you have pain, your body is telling you, I need to be protected for some reason. Now sometimes with chronic pain, that signal can be a little off, and that has to do with the brain and pain, and we can talk about that later. But if you've been doing exercise, you've been seeing your physical therapist, and it's not working, then you either need to adjust your exercise program and talk with your physical therapist, or the therapeutic relationship between the patient and the practitioner, we need to be very mindful and say, okay, what are we missing? What else could we be doing? And how do we move this person along so that they start having less pain, and we start to return them to their joyous and happy life? Because when you have pain, oftentimes you're not very happy.
Yeah, yes, that is definitely true. The other, I think, interesting kind of point here is that you also write in general that as you start to lose weight and lessen the inflammation, again, that connection between the inflammation and the pain. So then as the inflammation decreases through diet, probably primarily, then your pain will also decrease.
That's right. And patients make that connection. Oftentimes they go back to their doctor and say, no one ever told me that my diet could be the source of my pain and inflammation, or no one ever told me it was gluten. There was just that one thing that I needed. It wasn't the Advil, it wasn't the Tylenol, it wasn't a non-steroidal anti-inflammatory. It was that one food that was inflammatory for my body, that my body didn't like or reacted to, that was able to help me with my pain.
Mm-hmm. So what types of movement do you have your clients doing here? I assume it varies, obviously, by the condition they're coming to you, their condition of their body, and so on. But maybe you can just give us examples for people who may not be seeing you, but because they're reading your book, for example. What kinds of things do you recommend, and what kinds of things do you don't recommend?
Yeah, it's a really great question. So movement is as much medicine as nutrition is. So when we look toward movement or exercise, it should be prescriptive, just like we would prescribe a certain diet based on your bio individuality. Let's say you're someone who has not moved in a very, very long time, and you're fearful of moving. You're very, very fearful of moving, and your pain fluctuates, and you've had some kind of chronic pain syndrome, let's say like fibromyalgia, or CRPS, or RSD, or something that's very severe. For those patients, we're going to start out with very, very gentle movement. That could be something like a basic walking program. It could be a restorative yoga class. It could be something like Feldenkrais or Tai Chi. Mm-hmm. Something that's going to get you moving in a way that is relatively pain-free. You can have a little bit of soreness as you move and still be safe, but relatively it's pain-free. And you're going to start moving in a way that's comfortable for you, in a way that you can start to get to know your body again, and in a way that you start to build confidence, so that each week you can do a little bit more activity over the course of, let's say, 6 months as you build yourself back up. So my favorites, I mentioned a couple of them: yoga, Pilates, Feldenkrais, Tai Chi, Qigong. All those are really wonderful ways. You can see a physical therapist for a prescriptive exercise program. All those are really wonderful ways to start to move in a way that is not going to hurt your body, in a way that you can show yourself a little bit of compassion as you go through that healing process.
Yeah, that's Go. I was just going to add quickly that that's exactly what I'm doing, and I have gotten. The listeners probably know that I broke my wrist in late January, so I have been so happy just getting back into some of my yoga poses.
Yeah, it makes you feel good for almost automatically. What I want people to know about movement is, of course, it's going to make you stronger, and it's going to make you more flexible, and it's going to help with your daily function. So it's going to help you walk better, go up and down stairs, or do your housework, or anything you need to do, walk to the grocery store. So obviously it helps with your function. Mm-hmm. But movement is one of the best ways we have to open up the natural drug cabinet in our brain. So when you move, your brain naturally releases opioids. We have our own natural opioids in our brain, in our nervous system, that get released with the right amount of movement. And when you're doing the right amount of movement, that makes you feel good. Like you're saying, you fractured your wrist, and you probably didn't move for a while, and you started going back to yoga class, and maybe it was a little bit sore at first, and you worked through just a little bit of soreness, but as you move, you started to feel better. Of course, the wrist got more flexible and got stronger, but also those natural chemicals, those natural opioids, those natural endorphins are released, and they travel throughout your entire body. And when that happens, you become less sensitive to pain. So it's a way to really self-treat yourself. Mm-hmm. Now, once you're healthy and you're starting to move beyond the gentle yoga phase, I love people to lift some weights. Not very heavy weights, just twice a week, where you're doing a weight that's comfortable, anywhere between 8 to 12 repetitions. And you can just focus on doing some pushing, pulling, squatting, and lunging, just those 4 things. Mm-hmm. If you just focus on some kind of exercise where you push, like a shoulder press, or something where you pull like a row, and squats and lunges, 2 exercises, for most people that would do a wonder for them. It would be great form of medicine for them, because they would start to build their muscle mass.
Right.
All of us lose muscle mass as we age. Probably after the age of 30, if you're not working on your muscle mass by lifting weights, you're losing it. Now, what happens when you lose muscle mass? You become less sensitive to the insulin that your body produces naturally. So your muscles, don't burn insulin and sugar as readily. With less muscle mass, you're less functional. So you're not strong enough to do your daily activities. With less muscle mass, you're more likely to have osteopenia, osteoporosis that can lead to fractures. So muscle mass is very, very important when we look at almost every single chronic disease, including chronic pain.
Mm-hmm. And I think the strengthening also helps in case you had any muscle atrophy during your injury.
That's right. Sometimes if you have a limb, such as an arm or a leg, immobilized, like a cast, you'll see the atrophy very readily.
Yes.
But when people become sedentary over the course of many years, and they have a sedentary job, and they're really not doing much other than walking to and from the car, to work, or to the store, you don't realize how much of your muscle atrophy. So one of the things that's really important is to gain back some of that muscle mass. Mm-hmm. And there have been studies that people in nursing homes who are 95 years old plus can gain back muscle very quickly within a matter of 3 or 4 weeks, just lifting 2 to 3 pound weights around their ankles and their arms.
Wow. That's great. So I'm fascinated by the whole mind-body connection, in this case, the brain. So tell us a little bit about the brain, the science a little bit, just a quick snapshot, and then maybe some techniques that people can use.
Sure. It goes back to the early part of our conversation. So after that natural inflammatory process happens, where your tissue is healed, if your pain persists, then we're looking less toward the tissues and we're looking more toward the brain. For some reason, the brain has been stuck in what's called the harm alarm phase, or it's been stuck creating pain as an output. So ultimately, your brain is what causes pain. And that can be a shock for people at first, because they think the pain is coming from their knee or their joints or their back. But ultimately, no matter what type of pain you have, pain is always caused, or it's always an output of the brain. And the way I like to describe that for people is I often say, no brain, no pain. So if you didn't have a brain, or your brain wasn't functioning properly, you would have no pain. Now, what does this really mean? It means that that your brain and your nervous system becomes very hypersensitive. It becomes very vigilant. And it starts to produce pain at times when it shouldn't. So if you hurt your back, let's say, by picking up something that was heavy, normally you'd probably heal. But if the time when you hurt your back was a major stress was happening in your life, let's say you were in the middle of a divorce, and you were obviously dealing with lawyers and attorneys, let's say, which can be stressful, or you were changing jobs, or there was some other type of emotional trauma that was going in your life, all those types of things start to get added up by your brain, and your brain weighs all that information and says, okay, is the information that's coming into my brain saying that I'm safe, or is that information saying that I'm in some kind of danger? If the information coming into your brain says that you're in danger, one of the ways that your brain will alert you to danger is pain. So we see this in many types of patients. We see this in patients who have anxiety. We see this in patients who have stress. We see this in patients with early life trauma, where they've had a priming of the nervous system from an early age, and their brain is still producing pain, even though there's no injury.
That's really interesting. And so basically you're saying, and I'll use my wrist as an example, that the brain is really the originator of the pain. It's not, even though the location of the broken fracture in a broken bone, for example, is obviously physical. But the brain is signaling through chemicals, the neurotransmitters, the pain.
That's correct. So we used to think, probably about 20 years ago, that we had pain-sensing nerves in our body. So little nerves that sense pain. We actually have no nerves that sense pain. We have nerves that carry messages. And those messages are carried, let's say in your example, from your arm up to your brain. And then your brain says, okay, is this message enough to produce pain? Do I need to produce pain to let Christine know that she's in danger and that right now she should keep her wrist in a splint and let it heal for about 3 weeks? And then she can start to move it gently to alleviate the pain, of course, return back to normal. So we now know that there are something called nociceptors, which carry messages to the brain, and then it's up to your brain to decipher whether those messages are sufficient enough to produce pain. And let me give you an example, because an example can oftentimes articulate this better. So let's say you're walking down the street in a high-heel pair of shoes, and you sprain your ankle, and you tear some ligaments on the outside of your ankle. When you tear tissue, there's inflammation that happens, and with that inflammation comes swelling and heat and redness and, of course, pain. And right away, you would focus on it, and you would say, oh, I sprained my ankle, I need to go in and rest this ankle. I can't go out with my friends tonight to dinner. I have to rest it and maybe see the doctor tomorrow to make sure nothing's broken. In the second example, let's say you're crossing a busy New York street, and you're carrying your baby in your hands. At the same time you sprain your ankle, you notice that there's traffic coming at you at 40 miles an hour. Your brain is going to say, which is the worst danger here? Is it the traffic that's coming toward me, or is it my sprained ankle? So with that baby in your hands, your brain makes a split-second, a microsecond decision that the worst danger is the traffic, and you need to get to the other side of the street. So your brain will not produce pain in that situation.
Mm-hmm. That would be more the flight or fight response.
That's correct. So in fight or flight, many things happen. Now, once you got to the other side of the street, your brain would create pain because now you're safe from the traffic, but now your brain's saying, okay, the worst danger in this scenario is my ankle.
Mm-hmm. Yeah, that makes sense. So what are some techniques that you would recommend to people to try to change their mindset, perhaps, or to increase the positive, for lack of a better term, chemicals that we want, similar to endorphins, I guess?
One of my favorite ways is to making people mindful about some of their cognitions or some of their thoughts. And chronic pain, who have it for years and often decades, often have negative thoughts around their pain experience. And what I want everyone with chronic pain to know is that when I talk about the brain and pain, I'm not saying that your pain is not real. Your pain is 100% real. It's just that where it's coming from is not what you thought. So people have these negative thoughts that oftentimes go like this: this pain is always going to be here. I'm always going to have this pain. This pain interferes with everything in my life. This pain is going to be the death of me. This pain is torturing me. So negative thoughts lead to negative thoughts, and those negative thoughts can actually cause your pain to be worse in intensity as well as duration. So we work with people to start to reframe their thoughts. Many physical therapists know these as pain catastrophizing thoughts. And we work with people to reframe their thoughts, to work on a more positive mindset, a more positive intention, where they can lower those negative thoughts and in turn they lower their response or their sensation to pain. So how do we reframe those thoughts? Those are things like saying, well, even though I have pain today, I was able to go to work. Or even though my wrist is killing me, I went to my first yoga class today in 3 months. Or even though my knee still hurts, I've lost 5 pounds since I started working with my nutritionist. Or even though I have fibromyalgia, I was able to walk the 5K race today. So you find different ways in your life to start to reframe and bring your focus away from the pain and more towards the things in your life you have control over and you can influence.
Yes, that makes a lot of sense, and I think I've been doing that to some degree myself, because you have to kind of encourage yourself when you're going through this journey.
That's right. Pain is both a sensory and an emotional experience, and I have an online program called Heal Your Pain, Heal Your Life, where I talk about all of this, and I bring people not only through the physical aspect of pain, not only educate them about the nutritional and the inflammatory factors of pain, but also about the brain and pain and how your emotions can make that pain worse and what you can do to work on your emotions to lessen the pain so you can finally live a pain-free life.
Yeah, so it's all interconnected, and that's one of the things I love about your book is you've taken this really interesting and effective integrative approach, combining movement and nutrition and the mind.
That's right. It's all connected. And one of the things that I try to educate practitioners on when I talk to them about people with pain is that you have to use oftentimes 1 or 2 or sometimes 3 different types of approaches, because pain is multifactorial. It's not just the joint. It's not just the diet. Oftentimes there are many factors. People's beliefs, their thoughts, their emotions, all have an influence on how much pain they're feeling and for how long that pain persists.
Yeah, that is very holistic and makes a lot of sense to me. So I want to thank you so much for being on the podcast today.
Thank you, Christine. It's been great here to talk to you about how to heal chronic pain. That's one of my favorite topics to talk about.
Yes, and I can see why. And listeners, again, you can learn more about Dr. Joe Tatta on his website by the same name, drjoetatta.com, and his book is also available on Amazon as well as your site, correct?
Yes, that's correct. Heal Your Pain Now.
Heal Your Pain Now, and I love the full title, A Revolutionary Program to Reset Your Brain and Body for a Pain-Free Life. So next episode, I'll be talking about childhood obesity, which unfortunately is an epidemic, risk factors and strategies to help prevent and reduce childhood obesity. So thanks everyone, and have a great, healthy